The coronavirus has really sort of pulled back the curtain on some things that we already knew. That is that there are very clear and long-standing racial disparities in the health of our citizens. This is not just true in Ohio, it is true across our country. Disparities in health and health care are intertwined with social and economic conditions, as well as race, ethnic background, age, and even geography. While COVID-19 is bringing more attention to the gaps and the disparities that exist among our communities, the understanding that these racial inequalities exist is not new. 1967, the Kerner Commission, presidential group formed to find the root causes of civil unrest, pointed to inequities in housing, in education, social services, all based on race. Here are some statistics from today. Though we've seen a steady decline over the past 2 years in infant mortality, today in Ohio we still lose 900 babies each year before they reach their first birthday. And this tragedy disproportionately impacts the minority community. African American babies die at a rate of 2.5 to 3 times the deaths of white babies. For every 1,000 white babies born, 5.4 die, while for every 1,000 African American babies born, 13.9 die. The African American community is also losing more mothers. African American women are more than 2.5 times more likely to die of a pregnancy-related condition than white women. The overall life expectancy of African American Ohioans is 4 years shorter than that of white Ohioans. 72.8 years of age compared to 77 years of age for white Ohioans. African American Ohioans also have a higher rate of heart disease, higher rate of hypertension, higher rate of diabetes. Further, African American Ohioans are 2.5 times more likely to live in poverty than whites, and African American children in Ohio are 3.1 times more likely to live in poverty. Therefore, it really should not be a surprise to any of us that the African American community has been disproportionately hit by this COVID-19 virus. African Americans make up between 13 and 14% of the Ohio population, yet 26% of those testing positive for the coronavirus are African American. African Americans also account for 31% of COVID-19 hospitalizations in Ohio, and African Americans account for 17% of COVID-19 deaths in Ohio. Latinos make up 3.9% of the Ohio population, yet they make up at least 6% of the people who have tested positive for the virus in Ohio. And let me just say that we believe these statistics are even low. That's even higher than what these are, because for a while we had a pretty big gap of people, just the data was coming in without any race listed at all. So we know these are the minimum numbers, and we think they're probably higher. As governor of the state of Ohio, I'm deeply concerned about this. This is something that should concern every single Ohioan. When we see something disproportionately affecting some of our citizens, we have an obligation to act. We have an obligation to do something. These truly are, when we're dealing with health, these truly are life and death issues. I believe my job as governor is to help protect the safety of all our communities and all our citizens. Knowing that some of our citizens are disproportionately at risk as far as health is concerned based simply upon their zip code is something that should shock all of us. We have an obligation to be even more mindful in our response to helping those at higher risk because of these facts. It should not matter where you live or what race you are. If there are Ohioans who are especially hard hit, we have an obligation. Whether they live in Appalachia, whether they live in the city, wherever they live, we have an obligation to help them. To truly change things, we must address the social conditions that drive 70% of our health outcomes. Things such as healthcare access. Healthcare access, so very, very important. Education, so very important. As well as housing, transportation, employment, availability of nutritious food. Gathering and using data is key to understanding the problem, and it's also key to finding the solutions. Throughout the last 2 months, we've tried to get as much information out to all of you as we could about this coronavirus. Information about how it's impacting our citizens. Today, we are unveiling 2 new interactive tools on the data dashboard at coronavirus.ohio.gov. They look at key factors associated with health and well-being so that we can better determine vulnerable populations that truly need our help. The first is a map allowing users to access county-level COVID-19 data by race and ethnic background. And this is what it looks like, and these are the pullouts. This is not interactives up here, but when you look at it, when you pull it up, we hope you'll find that it is in fact interactive, because you're going to be able to go down right to a county and you're going to be able to pull up data from that county, everything that we know, everything that has been collected, and you'll be able to pull that up, case numbers, hospitalizations, death, data by race, data by ethnic background. The second map is not a COVID-19 tool, but it is a valuable tool, one that helps us understand where we need to target resources aimed at improving conditions for Ohioans who are the most vulnerable. This map shows us census tract level measures of what is called an Ohio Opportunity Index. Opportunity level from very high to very low is measured using 7 factors that impact health and well-being. These factors include transportation, education, employment, housing, health, access to resources, and crime. The higher the level in the index, the better the opportunities to thrive. You'll find a state map and maps for each county that allow you to look at overall opportunity levels as well as levels in each of these 7 categories. These maps can be used by nonprofit organizations. They can be used by average citizens, researchers, community, philanthropic groups, nonprofits, others to help guide the delivery of social services and to help solve problems and just to better understand what's going on in Ohio. Dr. Root from The Ohio State University developed the index in partnership with the Center for Urban and Regional Analysis, and I want to thank them for providing that tool. Each of us has a responsibility to be mindful of and work to counteract health disparities wherever they are found. Over the last 16 months, it has been my pleasure to work with the leadership of the Ohio General Assembly, Speaker Householder, House Minority Leader Amelia Sykes, Senate President Larry Obhoff, and Democrat Leader Kenny Yuko. I want to thank each and every one of them and all the members of the General Assembly. We have worked together this last 16 months to help prevent disease, promote better access to quality care, and improve the health and well-being of all Ohioans, no matter where they live. When I took office, the day I took office, that night actually, that early morning, I signed an executive order to create the Recovery Ohio Initiative and announced the formation of the Recovery Ohio Advisory Council to advise my office on critical matters concerning mental illness and substance use prevention, treatment, and recovery support services in Ohio. In early 2019, when the Ohio Department of Health released its most recent statistics on Ohio drug overdoses, and that report showed that African American males had the highest overdose death rate in the state, our Recovery Ohio responded with the creation of the Minority Health Working Group to make recommendations on reducing overdose deaths among minority populations and help ensure our state has the tools needed to provide culturally appropriate services to meet the needs of all Ohioans struggling with mental health and substance use disorders. Again, I thank the General Assembly for doing that. We believe that all Ohioans should have the opportunity to live up to their God-given potential. We're focused on developing tools and resources to help our most vulnerable citizens. Because of the unconscionable maternal and infant mortality rates in Ohio, we expanded home visiting programs. Our goal was to reach women in poverty, women who are struggling, to help them through the pregnancy, to make sure that the baby was born at a good birth weight, and to get that child on the way to a healthy start. That budget that was provided by the General Assembly significantly increased funding for Ohio's home visiting program known as the Help Me Grow program. And our goal today remains to triple the number of families served by that program. Another health concern, particularly in minority communities, is the presence of lead paint in older homes. In my State of the State address last year, I talked about how it is wrong and unacceptable that there are still children in Ohio today whose opportunities and whose dreams are stifled because of where they grew up and the fact that they grew up in a home with lead paint. Every year, thousands of Ohio children under the age of 6 test positive for unsafe lead levels, which can damage the brain and nervous system and cause slowed growth and development. To remedy this, we have put a renewed focus on preventing children from being exposed to toxic lead by increasing screenings, early intervention services, and the identification and the removal of lead paint, particularly in our poor communities. Through this work, more children suffering with toxic lead exposure or neonatal abstinence syndrome are getting access to early intervention services, and this is the right thing to do. We know that the support we give kids early on makes all the difference in the world. To help with that, we've also created the Ohio Governor's Imagination Library for our youngest citizens. This is something that my wife Fran is spearheading, and her goal, my goal, our goal, collectively as a state, is to make sure every child has books in their home at a very, very early age. No matter where they live in Appalachia, whether they live in our cities, any of our counties, every child should have that opportunity, no matter what their income. Working with the General Assembly, we have provided the resources to better meet the physical and emotional needs of Ohio's young people through our wellness program. Again, this is something where the General Assembly stepped up and made a big, big difference. The Euler School in Cincinnati, for example, has used their student wellness funds to enhance their school-based health care program. And they've had a long history of doing great work at that school. Through community partnerships, 94% of their students access physical and behavioral health care services right in their school building. Services include vision, dental, immunizations, and mental health care. Prior to creating their school-based health care program, 75% of students had dental disease or cavities. Today, 77% are actually cavity-free. Other schools across the state in different areas are following the Oilers' footsteps. Ripley Union Local School District in rural Brown County is using their student wellness dollars to open a school-based health care clinic for their students right in that school. We are grateful for the important work in alleviating health disparities that is ongoing by the Ohio Commission on Minority Health, the Commission on Hispanic Latino Affairs, and others, as well as our Ohio Department of Health's Office of Health Equity. These groups work to eliminate disparities through service to affected communities. They help expand our understanding of the scope of health disparity issues and build partnerships to address them on all fronts. They also help to increase minority representation in health-related fields. Now, health disparities did not occur overnight. They are complex and present complex challenges. The current coronavirus pandemic has brought into high contrast these troubling issues. And so to augment the work that we are currently doing on health equity and to address the immediate threats posed by COVID-19 to our minority communities, we formed the Minority Health Strike Force in April. We assembled a group of 41 people, some with backgrounds in health and all with ties to minority communities. And I asked Ohio Department of Aging Director Ursel McElroy, as well as our Director of Recovery Ohio Initiative, Alicia Nelson, to head this group. The subcommittees on the strike force have worked tirelessly to advise us on COVID-19 specific recommendations, including steps to address how communities of color are more likely to have underlying health conditions, less access to health care, and may experience discrimination when accessing health care services. These recommendations were created using feedback from the healthcare, resources, data, and education subcommittees of the strike force. A few examples from the report that's going to be released later today, and this will be a preliminary report that will be released. Just a few things to preview. Establishing culturally appropriate and accessible COVID-19 exposure notification services for communities of color is recommended. Expanding testing capacity and access for minorities and high-risk populations. Using data to prioritize resources in the communities that have the highest need. And also recommended developing and launching a statewide culturally sensitive outreach campaign that educates African Americans and other communities of color on COVID-19, health disparities, and social determinants of health. We have joining us on Skype, Cincinnati Vice Mayor Christopher Smitherman. He's a member of the strike force, and I want to thank all the members of the strike force very, very much for their hard work. And let me now introduce Christopher Smitherman, who has worked on this and someone who I've known for many, many years. Christopher, thank you very, very much for joining us. And there you are.
Thank you so much, Governor DeWine, for moving this issue of minority disparities forward at the highest levels in the state of Ohio. We all trust your leadership. I want to thank all 41 members of the strike force. We've all been working incredibly hard, as you have indicated. What I'd like to share with you is that those recommendations that are being formulated, in my mind, fall into 4 areas. And I'm going to call this MTAC, messaging, testing, accessibility, and collaboration. And so as the task force is looking at these 4 categories, messaging, Governor DeWine, under your leadership, is reaching the minority community where they are through the media outlets that exist across the state of Ohio, and making sure that we are using those leaders in each of those communities to deliver that message. The message about the importance of wearing a mask, which I have here in my hand. The message of washing hands and keeping the 6 feet of distance. The issues of testing. And so the area here, Governor DeWine, under your leadership and the leadership of the task force, is talking about making sure that we're testing in those vulnerable areas that have been disproportionately impacted that you've identified in this press conference, and making sure that we are concentrating that testing there in a fair and equitable way. The other area is accessibility. and making sure that through our federally qualified health centers, through our hospitals, through every avenue, that we are making the testing and the access to the information accessible to the minority communities that are being disproportionately impacted. And then the last area I would say would be collaboration, and collaborating with groups and organizations like the Urban League, the NAACP, with our faith-based groups, organizations, and leaders, our African-American fraternities and sororities, all of our chambers, whether it's the Latino chambers, the African-American chambers across the state of Ohio, and interfacing with the institutions, Governor DeWine, that you've provided leadership in already since you've been serving our great state, the areas of our Ohio Department of Medicaid, Ohio Department of Job and Family Services, our Ohio Department of Mental Health Addiction Services, the Ohio Latino Affairs Commission, the Ohio Commission on Minority Health. And so out of all of these recommendations, former Mayor Michael Coleman has raised the issue, which I know you understand, is making sure that we fund these recommendations and these initiatives. I continually hear the strike force talking about that particular issue. I want to thank Directors Nelson and McElroy and Community Relations Chair Ronald Todd for their leadership on the commission. I want to emphasize to you that we do have a very long relationship, and that I trust and continue to trust your leadership, that I appreciate your appointment of myself to the Minority Health Strike Force, and that I know that you will continue to allow the data that we have to drive us as we open the state of Ohio, prioritizing health, prioritizing safety, and the economy, as we target and make sure that the minority communities understand their specific risk. And so I'll close there with saying I thank you, and I thank Ohio, and Ohio thanks you, Governor DeWine, for your leadership and your team.
Christopher, thank you very, very much. I appreciate that. Dr. Acton, any questions or?
No,
anything?
I would say, sir, first of all, thank you so much. It's an honor to meet you in person, albeit this way. And I want to ask you, so many of us have cared about this work for so long, and we know we didn't get here overnight. And I know people sometimes feel that we can't move fast enough. Our will is entirely to do this work. Any advice that you want to give us? We know we can't change 40 and 50 years of things and more overnight. If you were us, given a pandemic, what advice would you have to heal and move forward in truly substantial and meaningful way?
Matching the, first of all, thank you for your question, Dr. Acton. Oftentimes, when commissions and strike forces are put together, the financial piece doesn't come behind it. And I understand and I know that this governor, when we roll out those comprehensive recommendations, that financially, whatever those recommendations are, that the financial support will be there to execute those recommendations. So unfunded mandates oftentimes come from task forces. And I know under Governor Mike DeWine that won't be the case. And then I also will say, Dr. Atkin, that testing in an equitable and fair way is a consistent message from the task force. And also, as the vaccination rolls out, that vaccination messaging, so we talked about the message of messaging, testing, accessibility, and collaboration, that when the vaccination comes out, that number one thing is making sure that the messaging is tight and that African Americans and Latinos are being specifically educated about the importance of getting that vaccination, and that the accessibility, meaning at our federally qualified health centers, at our hospitals, at our schools, in all non-traditional ways, in our churches, that the medical staffs are going directly out and working directly with the leaders in those communities to deliver those services of testing and vaccination.
Well, we want to thank Vice Mayor Smitherman, member of council. Christopher, thank you. We're very grateful for you serving very, very much. And you'll all be putting out the interim recommendations, I think, today, and then later in June, I think, final recommendations. I think that is what's occurring today. So thank you very, very much. We're very grateful.
Thank you so much, Governor. Thank you, Dr. Acton.
Thank you.
Today we want to announce several additional initiatives that complement and help implement today's recommendations that we're going to hear from the Strike Task Force later today. To help us during this pandemic to focus on the most underserved populations, no matter where they exist in the state of Ohio, we will have a person dedicated to the social determinants of health and opportunity. This person's work will build on several existing efforts to respond to health inequity by working directly with local communities on their specific long-term health needs, as well as our response to COVID-19. This person will be in the health department. Quite candidly, it's simply unacceptable, and should be unacceptable to every Ohioan, that in our great state of Ohio, in the year 2020, zip code still determines to a great extent how long you will live, how well you will live. 2/3 of our health outcomes are outside our control. Housing is certainly health policy. Education is health policy. Availability of transportation is also health policy. A primary focus will be on collecting the best data to inform the best practices to lead our strategy moving forward. Further, a key function will be to help ensure the implementation of the Minority Strike Force's short-term and long-term recommendations. So this is a position in the Department of Health that, frankly, we have thought about for a long time. It's past time, frankly, to get this done, and we will be doing that. I want to talk about one of the things that Vice Mayor Smitherman was talked about, and that's communications. As the Strike Force recommendations make clear, communicating important health messages to all people in the state of Ohio is very important, and it's particularly important during this pandemic. We are working with a group called Us for Us in partnership with the Department of Health and Minority Health Strike Force to unveil a new communications campaign called Stay in the Fight. This campaign will focus on the need to stay informed, stay involved, and stay inspired during the pandemic. We will share now a short video that describes this new communications campaign, and this is a work in progress.
My name is Johanna Terrell, CEO of Warhol and Wall Street, and we are a part of the Us for Us coalition. Hey, my name is Alonzo Edmondo. I'm with this awesome organization, Get Creative, and we are members of the Us for Us coalition. Well, one of the things that we realized is that there were many messages being developed and put out there to address COVID-19. And a lot of these messages that were intended to reach our audiences, diverse audiences, we knew because we were a part of these communities, we knew that those messages weren't reaching those audiences. And so this is what we specialize in. And so we wanted to throw our hat in the ring to join a team that was really ready to make some impact.
It's for all of Ohio to step up and step in. We need employers and we need investment. We need people to understand that this is a whole community issue, not just a minority community. This is for the whole state of Ohio.
Our approach is very practical. There's 3 pillars of the initiative, and that's stay informed, stay involved, and stay inspired. And those are also in line with the Minority Strike Force objectives as well. This campaign is not focused on just messaging or a mask. This campaign is focused on action. And so when we think about fighting, we think about who are we fighting for? We're not just fighting for our own health. We're wearing masks because we have to fight for our families. We have to fight for our elderly. We have to fight for our children. So we have to think about that when we say stay in the fight. You got to think about who you're fighting for.
Well, communication is certainly very important. So is testing. So I'd like to take a moment to discuss COVID-19 testing in our minority communities. To expand access to testing, we have partnered with the Ohio Association of Community Health Centers. They are uniquely qualified to help in this effort. The nonprofit association represents Ohio's federally qualified health centers, including 55 community health centers at 378 locations throughout the state of Ohio. It has multiple mobile units also in 68 of Ohio's 88 counties. So if you look at this, you'll see our outreach throughout the state. And they have the ability to really penetrate to our citizens who are not getting the health care that they need. So this partnership, we think, will help a great deal in regard to testing. The health centers are placed really in our most economically depressed communities, and they offer high-quality, comprehensive primary care. Nearly 93% of their patients are below 200% of poverty level. Community health centers have a unique reach. They are trusted in their local communities to provide primary and preventive care regardless of insurance status or ability to pay. It makes them critical to any strategy that we might have in regard to COVID-19 testing, and to make this available to all Ohioans. Make it available to Ohioans in our rural areas, our urban neighborhoods throughout the state. As you look at the map, you can see the reach. For testing, individuals should contact the federally qualified health center or community health center closest to you for information and direction about how to be tested. They have capacity. We are going to do everything we can to work with them to increase that capacity as we move forward. We are also partnering with the Ohio Association of Community Health Centers and Nationwide Foundation to distribute thousands of community wellness kits. We're grateful for this partnership, as these important kits will help protect families and communities that are disproportionately affected by COVID-19. They contain COVID-19 protection-related items, face coverings, hand sanitizers, and soap. This is what they're going to look like. And these are going to be distributed. Again, I want to thank Nationwide Foundation for helping us make this distribution. The Ohio Association of Community Health Centers. And they will find in here facial coverings, hand sanitizer, and equally important information. So we're looking forward to getting these distributed. To support both state and our local health departments in their effort to fight COVID-19 and the disproportionate impact in Ohio on people of color, we are significantly increasing the number of public health workers who can help notify Ohioans of possible exposure to the virus. We've talked about this. Our goal is to stand up about 1,800 of these workers around the state of Ohio. We are in the process of hiring these public health workers at both the state level and the local level. Our goal is to hire individuals who represent and reflect the makeup of their own communities. We are grateful for the General Assembly's support of these efforts and helping us move forward. This work is vital, and it's one of the best ways for us to go on the offense against our shared enemy. Their work will be key in helping to identify those who have been potentially exposed to the virus, to better allow us to disrupt the chain of additional infections.